How does TB stigma affect family members of patients with tuberculosis? Have you ever thought about how stigma impacts not just patients but their families too? Tuberculosis stigma is a serious issue that brings negative attitudes and beliefs towards those diagnosed with the disease. This stigma often arises from fear and misinformation, and it deeply affects family members in various ways. Firstly, the emotional and psychological impact on family members can be significant. They may feel shame, guilt, and isolation because of the stigma associated with tuberculosis. Concerns about being judged or ostracized by their community can lead to high levels of anxiety, stress, and even depression. When family members internalize this stigma, they might feel responsible for the patient's illness or fear that they could contract the disease themselves. Social isolation is another major consequence. Family members might find themselves excluded or discriminated against by friends, neighbors, and even extended family. This often happens due to misconceptions about how tuberculosis spreads and its severity. As a result, families may avoid social gatherings and lose their support networks, leading to even greater feelings of isolation. The economic impact can also be quite severe. Stigma can affect job opportunities for both the patient and their family members. Discrimination may lead to job loss or reduced chances of employment. Additionally, families may face extra costs related to health care or even relocation to escape stigma, putting a strain on their financial resources. When it comes to care and treatment, the stigma can create barriers. Family members play a crucial role in supporting patients through their treatment. However, stigma can hinder open discussions about tuberculosis within families and communities. This fear of being labeled can delay diagnosis and treatment, which can worsen health outcomes and increase the risk of spreading the disease. Moreover, children in families affected by tuberculosis stigma can experience secondary effects. They may face bullying or exclusion at school, which can lead to psychological distress. This cumulative stress can impact their development and well-being, creating a cycle of disadvantage linked to the social consequences of the disease. To address tuberculosis stigma, community education is essential. Dispelling myths about transmission and treatment can promote empathy and support for affected families. Healthcare providers should also engage families in counseling and support services to help mitigate the effects of stigma and encourage timely care. In conclusion, tuberculosis stigma significantly impacts family members by causing emotional distress, social isolation, economic hardship, and barriers to effective care. It highlights the urgent need for comprehensive strategies to reduce stigma and support families alongside patients.